Deputy President David Mabuza is expected to lead the inter-Ministerial Committee on COVID-19 vaccine in Nkomazi in Mpumalanga today. Now, the vaccination drive is to encourage South Africans to vaccinate. The Nkomazi area is still lacking behind as far as COVID-19 vaccination is concerned. Our reporter Tumelo Machogo is on the story. Tumelo, a very good morning to you and thank you so much for joining us at this hour. Now, obviously, a big task ahead for the Deputy President as the COVID-19 numbers continue to rise in the country. And I mean, we've just had another 124 people sadly die from the pandemic. What do we expect from the Deputy President today?
Well, Unati, the Deputy President is expected to arrive here any moment now. We can hear the helicopter actually flying above us, and he's expected to meet with the traditional leaders here at the Matamo tribal authorities, but also will be joined by ministers and deputy ministers. Already Deputy Minister of State Security is already here, Mr. Zizigodwa, and also acting Premier here, Vaccination, where they're already here to be going out there to encourage people to go and vaccinate. You remember that this province has also vaccinated just over 700,000 people have been vaccinated so far in the province. That is still lagging behind, especially this region, because it's quite rural. It's still lagging behind, especially when it comes to vaccinating people. And also there's been concerns about being raised about people not following the COVID-19 protocols, especially social distancing in terms of wearing masks in public. That has not been observed in this area. So I think that's why the Deputy President is coming here, to ensure that these people here, they also go out in their numbers to start vaccinating, but also to encourage people to follow the protocols, because we have seen a lot of issues here with a lot of people actually not wearing masks. But let's quickly speak to the Deputy Minister of State Security, Mr. Zizigodwa, just to give us information about what's going to be happening today. Ndate, thank you so much for joining us. Just talk to us about the program that is expected to happen today. Why Nkomazi was selected by the Deputy President, and also by the ministers and deputy ministers to come here, encourage people to start going out there in their numbers to vaccinate.
No, thank you very much. As you are aware that President Ramaphosa appointed an inter-Ministerial committee on COVID-19 vaccines, led by the Deputy President, who has just touched on now in Nkomazi. And part of that was to look at the issues of vaccination, so that at the end South Africa can go back to its own normal economic activity. That is why we've identified, whilst we appreciate that the decrease in terms of numbers of new cases, I mean, as of yesterday, they were quite improving, but there are areas that we're worried about in terms of their uptake. One of the provinces was Gauteng. The Deputy President led a team of ministers and deputy ministers to Gauteng. We're worried about Northwest. We're worried about Mpumalanga. We're worried about areas around Ehlanzeni, which include Nkomazi. Almost all age groups in the area where we are in Nkomazi. Of course, there are issues about vaccine hesitancy. We want to deal with those issues. We want to understand how best we can work with communities. You must understand the objective is that we want the country to go back to the normal economic activity. That's why we have Amakosi Lana just behind us. We will talk to them. We'll also interact with communities to find out how best we can improve from a low uptake to a high uptake, so that we are able, all age groups in the areas of Nkomazi, get vaccinated. Our view, as led by the Deputy President, is that part of dealing with vaccine hesitancy is to take vaccine to the people, as opposed calling people to go to health facilities, because part of that is also the challenge of many people who can't get to health facilities. So from these meetings, from engagements with Amakosi, we will then go to do door to door in the areas of Nkomazi. I must say that a number of ministers are also leading teams in the various areas of the province, like we did with other provinces in Gauteng and so on, because we want to make sure that, like other provinces are doing, that Mpumalanga is improving in terms of the vaccine uptake.
And obviously there is vaccine available, but people are not going out to take the vaccine, especially we've seen, especially in rural areas where people don't want to vaccinate because there's lack of information about this vaccine, and there's also hesitancy, there's also myths about these vaccines. But what is the message that you guys are going to be driving to these people? Because some of these areas, they're quite rural, so not a lot of information is reaching people at a time. And also they don't know where to get these vaccines because sometimes the clinics are far away from them, the hospitals are like 20 kilometers from where they live, and that is also maybe impacting on them going out there to vaccinate.
The issue about availability of vaccine is no longer a problem in South Africa. What we need to do, as you know, that we came as part of our innovation, we came up with what is called pop-up sites away from health facilities. One of which is what you see here today. This is not a health facility, but already there's a vaccination site. And we think that we must encourage that. That's why we were meeting in Nkomazi, because we think that some of their traditional authority councils could be used because they're quite accessible to the people. Because the issue about the distance, that issue has been addressed, but we need to deal with some of the myths about the vaccine itself, about its safety and so on, particularly around the age of 18 to 34, but we're more worried here because even the age of 60 and above here, the numbers are quite low. We hope that our message today will at least turn the situation around, because firstly, we want to make sure that the country goes back to normal economic activity full. And therefore, you can't go back with normal activity with people who are not vaccinated. Two, we want to make sure that the vaccine that is available in the country, the rollout is as much maximized as possible, including in these areas. In rural areas, the issues about the proximity where people, that issue has been addressed. And we think that meeting with Nkomazi is also part of addressing the issue about accessibility of the vaccine in rural areas.
Are you guys worried as government that, you know, some of these vaccines, because people are taking them as fast as possible, they will end up expiring, and then you guys have to end up discarding some of them? Has been that point where you have to discard some of these vaccines because not a lot of people are taking them and then they are reaching their expiry date?
We have not reached that point as yet. I think the manufacturers have assured, but also the manufacturers have assured us that within the time frame that we have set ourselves between now and the end of this year, we want to make sure that we think that we'll be able to reach our set deadline, but our set target of 60% and above of the population that would have been vaccinated. We think that the improvement in some areas such as the Eastern Cape, in provinces that are also rural such as Limpopo, KZN, gives us hope that we can do more better in provinces such as Mpumalanga as well.
Okay, thank you so much. That was the Deputy Minister in the State Security, Mr. Zizugorwa. Just speaking to us about the program today that is the Deputy Minister, the Deputy President rather, is expected to do here in Nkomazi. There are headmen and also traditional leaders here also waiting to arrive on the arrival of the Deputy President. Also, once the Deputy President arrives, there will be a community meeting with them. Also, after that, they will also lead a door-to-door campaign, making sure that they encourage more people to go out there and take the vaccine, because this is one of the areas where the vaccine Unati has not been taken a lot, and also there is a worry of a number of COVID-19 increasing in this area because of the lack of protocols that are being observed by the communities, but also the young people and older people are not taking vaccine, especially in this area. So that's why they are here to ensure that they encourage more and more people to go out there and take the vaccine. Unati?
Tumelo, before I let you go, so you've been in the area for quite some time, and just listening to what Minister Godwa had to say there, what are the people telling you? What's the reasons behind, the numbers being low? And I know when we talk about hesitancy, what we don't factor in is the fact that there's not enough campaigning in as far as what the vaccine actually does and education around the vaccine. You know, what are community members telling you?
It's exactly that, Unati, that a lot of people, they are, especially young people, they are going to social media, they are reading all about this information on social media, saying that the vaccine is not good for them, or whatever they read on social media. But that's why they have been telling us that they're not going to be taking the vaccine. Some people have been saying they're not going to take the vaccine, but also more and more people are worried about taking the vaccine, especially older people that we've been speaking to. They're saying that, you know what, we're not going to take the vaccine. They're worried that they're going to die if they take the vaccine. And that is why the I think the ministers and the deputy minister and the deputy president is here to ensure that they do go out there and inform people, they give correct information to people, because also some of these people, especially here in Nkomazi, is quite rural, and also it's quite it's closer to Mozambique and Eswatini, and the borders here are porous, and that's why it's adding to the numbers that are keep on increasing in this area because of the porous borders. People are coming in and out. They're not showing their COVID-19 test when they're coming in, because obviously you can't show a COVID-19 test if you're entering the country illegally. So, but also that is also contributing to what is happening here with the numbers that are increasing. But Unati, information is what is lacking, especially in these rural areas. I think that's why they are here to speak to these chiefs, because these are the people that will be driving the message to the communities, driving the message to those to the people out there, to their subjects, to ensure that they encourage them to take the vaccine. But information is actually lacking in communities such as this one, Unati.
All right, Tumelo, let's leave this conversation for now. We'll catch up with you when the Deputy President actually arrives